Good morning, and I hope that this camera, the new phone I'm dealing with, I just hope it stays kind of put and that we can get everything on video here. But I'm gonna actually go through my morning routine right now. And the whole idea of this morning routine is this is for people that either have chronic back pain, that surgery is not an option, physical therapy 5 days a week is not an option, chiropractic 3 days a week, whatever it might be, that's not an option. In other words, this is you managing your back pain every morning. And I'm gonna take you through what I do for someone who for about the last 15 years has basically combated, right? And almost eradicated daily back pain. I have my bouts, I have my flare-ups. Most people that know me know that I, deal with flare-ups. I'm so thankful for the chiropractors in my life here in Texas, back when I was in Rhode Island, who, really, have, been amazing and, kept me out of a situation where I would need 5 days a week of care or surgery. So what I'm going to do is take you through this routine. Now, this is also applicable. A lot of my patients, when you see this is applicable to you. If you have an acute disc injury, if you've hurt your L5, S1 disc, if you've hurt your L4, L5 disc, these are going to be very applicable. Hopefully the volume picks up everything, and here we go. So first things first is this is only to be done after you're out of bed and you've walked around a little bit. Always and forever you want to get some motion through the spine, just your natural cadence. So again, I'm not kidding. I mean, we're talking about walking around the house in the morning just like this, and then we're going to go right into the routine. So the first thing we're going to do is take our spine through a little bit of natural kind of a plank exercise and then passive extension, and you'll see what I mean.
So over here, I'm just going to basically start with a simple plank. Now, I don't want to just drop into extension right away because that could actually aggravate my back in the joints, even if it's good for the disc. So think about getting into this position where you're kind of in just a push-up. If you're not strong enough to do the top of a push-up, that's cool, you can be on your elbows. This will be even harder, but it'll challenge your core. Now, you don't need to stay here for any more than 30 seconds. And if you needed to be on all fours, again, I guess this is called tabletop, that's fine, you can be here. So the first thing we're gonna do is actually get into that passive extension to just decompress our backs. So all you're gonna do, like I cue people in the office, just wiggle your butt and relax everything. And all you're gonna do is press your elbows to kind of get into a cobra pose. Now that's gonna be, for my chronic bad back people, that's gonna be about 20-30 seconds, that's it. And then you're gonna come right back up into that tabletop, and you're gonna slowly start doing that cat-cow. So you see what I'm doing? I'm going into big time flexion and extension. I can either do it this much, only a few degrees up and down if I'm kind of acute. I can go all the way up if I want to challenge, and I can round my thoracic and come forward, but that's not ideal. What's ideal is, see how far back I am now? And I'm getting that pelvis to open up and come back down. I recommend if you have an acute back injury or a disc injury that it's just a small motion. Now, the next thing I want to do here, and again, if this begins to make the pain go down the leg in any way, shape, or form, you're not going to do this. But if it feels good, you are. And that is getting into a push-up position. My legs are straight, my back is straight. It doesn't matter whether we're here, it doesn't matter whether we're here. Just want to feel good. And I'm simply going to do almost like a mountain climber kind of thing, but it's just getting my toes in flexion and extension off the ground. So I'm kind of bending my knees, and I'm starting to floss my lumbar spine. I'm flossing the sciatic nerve from side to side. And then I can go to a more sustained hold, so I can take one foot and just put it on the back of another, and then I lean open like this. If you can see what I'm doing here, this is stretching my left hamstring. You're going to do this very carefully. You're not going to push it, but you're going to feel a big stretch in the hamstring. And then you can even come forward like this. Again, through extension. I'm elongating and challenging my muscles here and my nerve on that side. And then I'm coming back and decompressing it like this as well. You don't have to have the foot crossed for this. I prefer to challenge and stretch that nerve and stretch those tight hamstrings and hip flexors. And then I can come right back to that top push-up position and just kind of come down like so. Challenging the upper body. Again, now here I am through traditional like lumbar extension. But I don't have to be all the way down where it's hurting those joints. It's kind of open still, and I'm stabilizing my core. See, even shaking a little bit here, but I'm still having a neutral lumbar spine. And I've challenged it through flexion and gained range of motion and went back into extension, which is good for the disc. So the last thing we're gonna do, because there's probably various other variations we can do, but that's a good routine to kind of, again, kind of combat these chronic disc injuries, chronic lumbar spine pain. You can always do glute bridges, but this last one is really gonna be all about adding stability, and that's that bird dog. So opposite hand, opposite leg. If you're not stable enough, or if you're very acutely injured, you can simply be here in that tabletop position and just reach that leg back. It's not this, it's this. All the way reaching back, but you don't want to overstrain. You're going to feel the muscle, when it's really turned on, you're going to feel this muscle really, really burning, the back of the hamstring burning, and in here should feel like a really nice stretch. And we're getting the glute muscles and the hip flexors to start turning on to take some of the pressure off our lower back, because our lower back is doing too much work to support us. That's kind of the key as to why it's so fatigued all the time. It's bracing and bracing to provide stability for because of the vulnerability of the disc issue. So we have to do, that's why that first exercise is so important, is to just kind of turn this off and then come right up in here into the, cat-cow. We need to start reinforcing that it's okay to move through the sacro-lumbar joints of the lumbopelvic region of the spine. And then, like I tell all my patients, if there's a bad symptomatic leg, once you feel strong enough, confident enough, and it's not just absolutely detrimental, or you don't feel like your back's going to explode, to just kind of grab a hold of something, or swinging your leg up like this. Again, if you're too acutely injured, you don't have to do that. You can use something to hold on to. But if you're starting to get over that acute pain, we need to be able to do a single leg lunge and load the back of the glutes and hamstrings, not the knee, and just kind of raise up like this. So again, you can turn that into something for repetition.
I hope this video wasn't too long. I'm going to show you one other exercise that you can do, just in case that this is not working at all for you. And look, whether we have a flexion or an extension intolerance at a given joint, especially in a chronic situation, is going to determine which exercises work and which don't. So I'm going to show you 2 more exercises that I think you can put in the morning routine if those simply are just not cutting it. I think everyone should do the 20 to 30 seconds of kind of that cobra passive lumbar pose that I started with. But I also think that everyone should do the cat-cow. I think everybody should do that. You just have to find your range. Is it going to be, rounding out this much? Is it going to be rounding out this much before you drop the belly down forward, okay? But this one right here, there's 2 more. Here we go. Typically known as the piriformis stretch for sciatic pain. Again, so now I'm rounded out in more flexion, so I'm opening those disc spaces. And if I have pain on my left leg, as an example, my left leg is crossed, and I'll just take my right thigh underneath my right thigh and pull, and we'll begin to feel, and you want your head back for this. I'm just talking to the phone so you can hear me. But you want to do this, so it stretches that piriformis muscle. A lot of times, so if I'm symptomatic on the right leg now, I can just pull this back and begin to really stretch this muscle. If you see me smacking it here. But you're not going to crunch. You're just fingers interlaced on the stomach, looking straight up. Deep breathe through the belly. We have to learn how to breathe through our diaphragm. And I've told this to several people before as well. Very weak adductors, adductors are very weak and turned off. None of us ever really use these, right? We think about being, in the gym and, using the machine like this. Oftentimes hands in the middle, see if I can get a better angle for you on this, but hands in the middle of the thighs like this, and you just kind of press and press and press and press and press. So maybe 10 or 15 of those. So basically by activating your adductor, your adductor group, can inhibit how turned on and overactive the outside part of the group is. Because remember, when it comes to anything in life, but especially exercise, body limitations, it's going to be it's a principle, right? It's a principle of diminishing returns. The more we do something, the more proficient and efficient we become at it, the greater amount of repetitions eventually becomes something that eventually we will plateau. The body will become so accustomed to it that there's no longer a benefit. So without getting too much further into that, I hope that that helped. I want this exercise. I want these routines to work for people. I mean, hey, when it comes to what kind of pain is worse in the body, no pain is worse than nerve pain. And the nervous system controls everything. It can shut you down. And I've seen the most badass people get around with hurt necks and hurt wrists and hurt elbows. But if that back is just seized, you can't work, you can't walk, you can't get out of bed, hurts to go to the bathroom. It's devastating. So my low back people that have had herniated discs, that you might be dealing with one right now, or every other day or every month, and you got to pop tons of Advil and muscle relaxers and whatever you can to get by, you're contemplating surgery. You guys have to get on a routine like this, because inevitably you are going to be the one that keeps you out of surgery for forever. Nobody else but you. Remember that. Me being a chiropractor, I know how important what I do is, but if you don't take responsibility with these types of exercises to what you can call it flossing your spine, stabilizing your spine, mobilizing your spine, all these, strengthening your core, pelvic floor muscles, all these different things, you won't have much success combating it for life and being able to live what is really a normal life with lots of fun daily activities, doing what you love to do, but you're going to have to do these exercises every day, sometimes multiple times a day. All right, everyone. Till next time, it's Dr. Pearlman.